Hi, this is Dr. Bonner with Personalized Wellness. Today I'm going to continue this series of videos that I was talking to you about as far as metabolic health, what we do here at my clinic. So essentially you've come in for your initial visit. We've gotten some demographics from you. We've gotten a little bit of information from a questionnaire. We've done a waist to height ratio. We've looked at vital signs to establish what your blood pressure is, because those are two components of metabolic syndrome. Remember, metabolic syndrome to me is the easiest way for you to evaluate, and actually for me to evaluate, where you are as far as your overall health is concerned. So in review, the 5 things that make up metabolic syndrome. Elevated waist to height ratio, so essentially an increase in visceral fat. Elevated blood pressure, so essential hypertension, that increases your increases your risk of many different things as far as disease processes in your body. So those are 2 components of metabolic syndrome that we can measure easily here in the clinic without, you can measure at home for that matter. So now we've gotten to the fact that we're concerned about metabolic syndrome, and we know that 88% of the population is unhealthy. So the other 3 things from metabolic syndrome will derive from the lab work that you get on that first initial visit to the clinic. So triglycerides are going to be one of the components. HDL is going to be one of the components. Your fasting glucose is going to be one of those components, but we're also going to get a fasting insulin here at the clinic, and we'll go over those. So those are our concerns, metabolic syndrome. So now we've gotten lab work, and what labs besides those particular labs? We know we want to get the lab work for metabolic syndrome. So we know we want to get a lipid panel. So lipids, so that's going to give us your triglyceride level and your HDL. And to be honest, I really like a triglyceride to HDL ratio. And if we can get that below 1, I really like that a lot. So that's something we're going to look at for sure. We're going to get a glucose level. That's going to be fasting. I would like to see that fasting glucose below 85. We're going to get an insulin level. I would like to see that fasting insulin level below 5. Ooh, that wasn't very good. Below 5. Why is the insulin so important? Well, if you don't measure insulin, you don't know how much insulin it's taking to give you a glucose. And this is a whole talk in itself, but you can take 2 patients with the exact same glucose level, fasting glucose, say 105, and you can basically think, well, that's exactly the same patient. But if you don't measure insulin, you don't know how much insulin it's taking to give you that glucose. So one patient may have a fasting insulin of 5 and have a fasting glucose of 105. That patient is metabolically relatively healthy as far as glucose goes. The other patient, though, may have a glucose of 105. You measure an insulin level and it may be 70. So it's taking a lot of insulin to give you that glucose of 105. So those are different patients metabolically. Okay, so we get these, we get these basic things, and that makes up our metabolic syndrome. So those are very important. Now, quickly, because I don't want to spend a lot of time on this because it's basically just another talk that we could do. The things that I like to get as far as lab work right up front is I get a CBC, I get a complete metabolic panel. That complete metabolic panel is also going to give me your liver enzymes. I really like looking at liver enzymes, especially ALT. And I like to see that ALT below 25. I can tell you, after being in practice for now 25 plus years, whenever we saw an elevated ALT in the 90s, early 90s, you just assumed and you started asking questions about alcohol use, that sort of thing that damaged the liver. Now I can tell you the majority of elevations in ALT is from non-alcoholic fatty liver disease. And it's really important to get that number. And that really helps us out a lot to tell us metabolically how healthy you are. I also like to get a uric acid level. And not so much looking for gout. That's what we normally think of with uric acid. This is a pretty good marker for how much fructose that you take in a day. The more fructose you take in, the higher your uric acid level is going to be. So it gives me an idea of your diet, especially after you've been in the clinic a while, how well we're adhering to the diet. So there's CBC, CMP, we get that uric acid level. I've already told you we get an insulin level. That's an addition. We get the lipid panel. For thyroid, I like a TSH, a T4, a free T3, and I also get a TPO, which is an antibody measure to look for Hashimoto's thyroiditis. So that's my typical thyroid panel. And then I always get a vitamin D level. Very, very important to get a vitamin D level. Talk to your family doctor. Always get a vitamin D level, at least once a year. And frankly, I like to see that at 80, 70, 80, something like that. And most doctors are going to think that's too high. I like that level a lot. Okay, so now we've gotten these. So and again, we'll go in more depth in some later videos with these particular lab values. For females, at that point, so now we know exactly what we've gotten for as far as basic lab work. I also want to get hormone levels. So for females, I get an estrogen level. So that would be in the form of an estradiol level. I get a follicle stimulating hormone level. I get progesterone. And I get testosterone. And again, that's going to be a talk in itself as far as, things that we do here in the clinic, and hormones are a big thing. I think you have to be hormonally healthy to be metabolically healthy. But again, that's going to be another talk. And besides the total testosterone, we also get a free testosterone also. With men, I don't get an estrogen, I don't get a follicle stimulating hormone, I don't get progesterone. We do get a total testosterone, we get a free testosterone. We get an SHBG level. That's not very good. An SHBG level, and we also get a PSA. And that pretty much runs through all the lab work that we get here at the clinic. And it's quite a bit of lab work, but it gives us a lot of information, and it really sets us up for that first consult that you have with me. Okay, next video. Basically, we're going to transition now. You've done all the lab work. I have all of this information. I've got a basic questionnaire concerning what medications you're on, your allergies, your medical history, your surgical history. And then when you come in to see me for a consult, we'll go over that in the next video, what takes place during that consult, what questions I ask, what things we're looking for, diet, nutrition, sleep, that sort of thing. And then the video after that, we'll talk about a carotid ultrasound, which we typically will do here in the clinic. And we'll kind of go through that. And I'll actually show you some images with the carotid ultrasound. And that's basically it for today. That's the lab work. That's that initial visit that you've come here to the clinic. Next visit, you see me. Thanks for watching the video. If you've not subscribed to the channel, hit that subscribe button. It helps us out. Thank you for watching. Give us a call here at the clinic. We'd be happy to see you. Thank you.